Hello, I'm Al Richmond, Executive Director of Community Campus Partnerships for Health, based in Research Triangle Park, North Carolina. Welcome to today's session of At the Heart of the Matter, a virtual convening developed to support the work of historically Black colleges and universities, their administrators, faculty, staff, students, and community partners. This webinar and others can be found at our website, ccphealth.org. Today's webinar is actually part 2 of a series focused on COVID-19 and the response of historically Black colleges and universities. It's been an amazing journey as we explore the myriad of issues associated with cardiovascular disease, COVID-19, and related health disparity topics. The At the Heart of the Matter project is funded through the Patient-Centered Outcomes Research Institute. Out of COVID-19, have emerged 2 societal issues that really continue to plague our nation. It's during the past 19 months that we have really begun to look more deeply at issues around health equity, as well as racism in the US and globally. Historically, Black colleges and universities are well positioned to address both of these issues. The impetus for the At the Heart of the Matter is a fundamental belief that I hold as a 1981 graduate of Livingstone College in Salisbury, North Carolina. And I thought it appropriate as we wrap up this webinar series to share with you a little about Livingstone. So I'm going to take a point of personal privilege. Our founder, Dr. Joseph Charles Price, was born in 1854 and lived to 1893. Few individuals have made their impact on their times or left a legacy to their beneficiaries as did Dr. Joseph Charles Price, founder and first president of Livingstone College. Born February 10th, 1854 in Elizabeth City, North Carolina, he rose to fame and well-renowned as a scholar, Christian gospel preacher, orator, and shining example of selflessness and devotion to his people. Between the years of 1854 and 1893, he founded Livingstone College and was our first president. A brilliant scholar, a world-famous orator, Dr. Price is remembered as the founder of Livingstone College and a man who made a difference in his lifetime. So it's in that spirit that I welcome you to this webinar series, At the Heart of the Matter. We believe that it's important for historically Black colleges and universities to catalyze their leadership role and trusting relationships in communities most directly in experiencing health inequities and the adverse impact of structural racism. I am proud of the role that historically Black colleges and universities have assumed in addressing the COVID-19 pandemic. The attention to safety and adherence to public health guidance extends to attendance at campus-based activities, including athletic events. As we're in the current football season of 2021, it's really important because it's this time of year that many historically Black colleges and universities celebrate our homecomings. Many of the games have continued this year because they were canceled last year. And so throughout the Southeast region and the CIAA and MEAC conferences, alumni, students, and student athletes have gathered for age-old tradition of football between other historically Black colleges, universities, and others as well. This is so important to us. This year, I will actually celebrate my 40th class reunion from Livingstone College. Livingstone and other institutions are taking every precaution to mitigate the spread of the virus. Today, we will focus on the work of HBCUs, or historically Black colleges and universities, as they pivot, refine, and engage in rapid cycle innovation to create safe learning and living environments for administrators, faculty, staff, and students. Next slide. I want to say a little bit about Community Campus Partnerships for Health. Our mission is to promote health equity and social justice through partnerships between communities and academic institutions. we value health broadly. And so we don't limit it just to kind of the physical, biological factors, but health for us includes economic and business development. It includes the places where we live, worship, play, where we thrive. So we see health very much in a holistic standpoint. Next slide. The At the Heart of the Matter seeks to engage HBCUs, the researchers at those campuses, patients and advocacy organizations to really address cardiovascular disease and to share with them more information about Patient-Centered Outcomes Research Institute, which I will say more about. Our convening series has expanded beyond a focus on cardiovascular disease to include a focus on COVID-19 and related health disparity topics. Next slide. I want to share with you the objectives of the At the Heart of the Matter project. It includes to increase the knowledge of HBCU researchers, faculty, and African-American patients and advocacy organizations of PCORI, to identify priorities in cardiovascular disease as it relates to cardiovascular disease research and engagement for African Americans, primarily in the southeastern region of the US. Third, to establish a network of HBCU researchers, patients, and stakeholders, and finally, to develop an action plan to move us forward. Next slide. I want to acknowledge that this series is made possible through an award from the Patient-Centered Outcomes Research Institute through the Eugene Washington PCORI Engagement Award. The opinions presented in this work are solely the responsibility of the authors and do not necessarily represent the views of PCORI, its Board of Governors, or Methodology Committee. Next slide. A word about PCORI. The Patient-Centered Outcomes Research Institute was actually established through the Affordable Care Act during the Obama administration. The vision is that patients and the public in general would have information they need to make decisions that reflect their desired health outcomes. The mission of PCORI is to help people make informed healthcare decisions and improve their health, the healthcare delivery system and outcomes by producing and promoting high integrity, evidence-based information that comes from research guided by patients, caregivers, and their broader healthcare community. Next slide. So PCORI has many different components to it, but I want to focus primarily on that of engagement. This is some work that I really value from PCORI, and it focuses on the intentionality of engaging patients, caregivers, and all of the stakeholders throughout the entire research process and research enterprise, from topic generation to dissemination, implementation of results. PCORI also focuses on methods, research, dissemination, implementation, and infrastructure. Next slide. The PCORI Engagement Awards, and the At the Heart of the Matter is one of those awards, is kind of housed on what I call the engagement side of PCORI. There are two arms. There's more the research side, there's the engagement side as well. So this particular award is on the engagement side. The engagement priorities for PCORI include developing a PCOR, or Patient-Centered Outcomes Research Community for Engagement in PCOR, promote dissemination of PCOR findings, and engage community in PCOR. The three program areas include capacity building, dissemination, initiative, and stakeholder convening support. This particular award, At the Heart of the Matter, is through the Stakeholder Convening Award. So when you look at the website, pcori.org, PCORI.org, you will discover that they have three funding arms within the Engagement Award portfolio. Awards that increase capacity of community-based organizations, patient advocacy groups, and others. Then there's the dissemination arm to disseminate the findings of that work. And then the stakeholder convening support, which is, again, the mechanism through which we receive funding to support our At the Heart of the Matter. This allows you to spend up to $100,000 over a one-year period to convene key stakeholders to discover more about PCORI and to advance a commitment and work around PCORI, to actually convene people for the purpose of coming together. For us, it's to develop an action plan. In other instances, is to convene stakeholders to disseminate information, and may also be used to gather information as well. Next slide. So I want to welcome today our speakers. We decided on this particular session, which is part 2, to focus on the work of historically Black colleges and universities and how they're responding to COVID-19. We do have an ulterior motive, and our ulterior motive is to really spark their interest in pursuing funding through PCORI. So as you listen to them, we hope that it will generate some ideas on your part, and that you will pursue funding through PCORI. Again, to find out more about PCORI, visit their website at pcori.org. Our first speaker is Symentha McDonald. She's the coordinator of student activities at Bishop State Community College in Alabama. Welcome, Symentha, and take it away.
Hi, how's everyone?
We are great.
How are you?
Great. So at Bishop State, basically, I took care of being the student coordinator of COVID. Obviously, when COVID struck, it really diminished my student activities on a great level, and obviously we went virtual. Dealing with students at the community college level who are used to getting that extra piece of that extra piece that we give them and everything. Obviously, switching over to virtual was a handful. So, I took that time to try to spend time in assisting students to make sure they were staying up, spending my time, just make sure they were staying up and staying engaged and staying positive, along with staying healthy. But on the staying healthy end, I end up being the COVID tracker for the college to help students do what they need to do to get the access to the services they needed, and help them with documenting their illness for their instructors so they could get the extra help and assistance they needed to help them through not only, their sickness, but to help them still remain being engaged and successful for the semesters through COVID. We hit a patch where things got better, and then, things kind of started to decline again. So we had to, pick back up with that. In addition, just worked with trying to help make sure that moving forward, we had a COVID plan for activities and how we would work, on campus, how the students would be able to interact with one another, how we would go about trying to clean, disinfect, socially distance, and still engage and have a good time. These are our main things that we're doing to try to help move forward. And as we continue to try to mitigate the effects of COVID, we're now moving forward to the era where we're trying to do all we can, as we've done it for some months now, but moving into more offering students more stipends and assistance that they may need to help ensure that they are vaccinated, and just talking about general health and well-being overall, so that we can try to stay on top of this moving forward and not have to go down and face some of the harsher challenges that we had to face when this hit us so abruptly. That's basically my spiel, and I'll not take up too much time, but turn it on over.
Thank you, Symentha. I have a question for you. So, is is Bishop College, I was going to put those two together.
Mhm.
Is it a residential campus?
We do not have a residential campus. We don't have any dorms on campus. However, our athletes live pretty much together in an apartment community that's local. And obviously, even though that's not necessarily associated with our school, our athletes are, and them living together did create a kind of situation for us at the beginning of COVID, but we worked to mitigate that as well. They living together and riding together, as students often do, can create some challenges.
Thank you so much. And Symentha, stick around because we want to have you to come back and talk a little bit more during a panel discussion as well. Thank you. Next slide. Our next speaker is Suzanne Williams, who's the Director of Health Services at Voorhees College in South Carolina, and Voorhees, South Carolina. Suzanne, welcome.
Thank you so much. It's my pleasure to be able to speak and talk about little old Voorhees to everybody. The pandemic first started. Oh, I'm sorry.
Yeah. Would you turn your camera on?
Not a problem.
Thank you.
So when the pandemic first started, it caught us off guard. We eventually had to send our students home due to the shelter in place initially. And that's when we started preparing. We started thinking about what we're going to do to bring them back. So in the spring, we brought back 147 students to kind of like a test run where we put in different protocols. So all of our buildings, academic and residential halls, and we have a little less than 400 students. We have 207 that live on campus. So all of the residential halls, all of our academic buildings, they have temperature scans in them. They have the health stations, they have the mask, sanitizer, and the Kleenex. We also have automatic hand sanitizing stations placed in each building too. We had to do some protocols based off of CDC and DHEC regulations. And with those, we went to our mandatory COVID testing every 2 weeks for everyone. We have the mask mandate, where anytime you come into our campus, you have to have your mask on. This includes faculty, staff, students, any visitors that you may have. We have a protocol in place for visitors. They're not allowed on the residential side. Our faculty played a huge role in helping us stay safe, because after each class, they disinfect, they sanitize their rooms. I supplied them with the Lysol wipes, Lysol sprays, and after each class, they wipe their classes down. Classes have been a minimum. They're not a full-size class now. So we kind of keep the capacity in mind also. And as far as like our events that we're having, homecoming begins for us November the 7th. So we're doing kind of like a hybrid student-centered homecoming. So we're not having any like our Hall of Fame dinners. We're not having those. Everything is going to be virtual, but we are continuing with the student-centered events. So all of the programming that we have for students, that's still going to happen. We have not made a vaccination mandate. We do have a vaccination initiative where we are offered, well, the students will receive a $100 Visa card once they show that they're fully vaccinated. Also, if they're not, to kind of increase the incentive for keeping them in compliance with testing, they have to get tested in order to have visitation. So those of us that know, that have a residential campus, we know how much visitation means to the students. So just trying to encourage them to get tested versus the visitation, get vaccinated versus not, just really making them aware of things that the benefits of being vaccinated. So we have that ongoing vaccination initiative. Our students have single rooms. Our athletes, we have a specific protocol for them. But we don't have football, but we do have basketball, and that starts on the 26th of October. So with our athletes, all of our athletes, we test them prior to leaving for competition, and then when they come back, they get tested also, just to kind of keep a trace of where COVID may have been contracted. Right now, our campus has a 0.5 positivity percentage rate. And I think we're doing a great job. We're just evolving and we're very fluid like the situation is. You just really can't say you're going to stick to one thing. You stick to it while it's working, but you have to be able to adjust and be flexible. That's what we're learning here.
Thank you. As you were talking, I was really thinking about what are some of the issues that have kind of surfaced for students, as well as faculty. I'll go on camera too. In this moment, I mean, what are the issues that you're hearing from some of the students around even the vaccine or related topics?
A lot of students are very hesitant to receive the vaccine because maybe my mother said, you don't, this is not good. Or the fact that they're hearing contradicting information. And, the CDC disseminates that information, but if you're not truly in the health field, that language, you can interpret that language differently. So, we have a lot of COVID-19 information sessions where we let them know what's in the vaccine, what it does, what it doesn't do, so they can feel more comfortable. But our biggest challenge that on campus and even with our online students was mental health and with our faculty. So we have a mental health contract with our counselor, and it's free to our faculty, staff, and students. So every week I'm sending out information, just flyers, targeting specific depression, anxiety, self-care, and it's for anybody, and it's at no charge. So we have that push going. But as far as the education, the lack of education, and I believe what my mom tells me, that type of thing. My mom said, so they have that in their mind, and it's kind of like an ongoing whirlwind for them. Like my school is telling me this. My mom said this, and my granny said that, and their word holds weight. Mm-hmm. So, and then they're thinking, well, you just want us back here for the money. It's always something that they bring into it. So just letting them know that their health and their wellness is our main priority, regardless of what. And I always let them know, whether you're on campus or if you decide to get your education online, we still care about you. And these services still exist, mm-hmm. And the facts don't change. The vaccine may not prevent you from contracting COVID, but it will definitely help you survive it. And that's a fact, just letting them know those benefits and respecting their doubt or respecting their hesitation because of the health disparities that African Americans face. Mm-hmm. And not just with COVID, but with high blood pressure, with any area, medication, treatment, the treatment that you receive when you get there, or the timely manner that you receive that treatment. So, it's just a real battle that we have to be conscious of all the time.
No, thank you so much. In previous sessions, as part of this series, we've had a discussion around mental health issues. And so it's really kind of interesting that you really lift that up as one of the concerns that you see among both students, faculty, and others. And sometimes we forget that faculty and others are really being impacted in this moment as well, from really the pressures that are associated with really with COVID-19.
Yes. So I was really surprised to see how many of our faculty and staff members assumed wanted to have the services. I was surprised. I was pleasantly surprised because a lot of, even if you have the opportunity there, one of our own barriers we have to cross is admitting that we need those services and letting them know that it's okay, especially with African American, because the first thing we hear is nothing's wrong with you, or it's like passive, they just pass it off and, you're weak or whatever that case may be. Those stereotypes that you get labeled for because, you want to talk to someone. And it's okay, because going to counseling does not mean you have to have a mental illness. You want to be mentally well also. And people have to understand that, and getting that out there, letting them know there's nothing wrong with wanting to unload and unpack. You know, you don't have to have a diagnosis to receive mental health services. And we're going to continue to push that.
Thank you. And please stick around for further discussion. I'd like to welcome our next speaker. Terri Tilford, Dr. Terri Tilford is the Director of Counseling Services at Winston-Salem State University in Winston-Salem, North Carolina. And Dr. Tilford, we welcome you today, and we're glad to have you. It's interesting. I was just thinking about the continuum of schools that we have, some smaller, Bishop College and Mobile, Alabama, Voorhees in South Carolina. And now we're moving up to North Carolina and this Winston-Salem State University, which is a really large institution, but also one of the schools that's part of the UNC system here in North Carolina. Welcome, Dr. Tilford.
Yes, good afternoon, everyone, and thank you for the invitation to be a part of this panel today. Happy to share kind of the work we've done here at Winston-Salem State. I think that the work that we have done here has been very impactful to not only support students, but faculty and staff as well. Our starting point is really information that we get from CCMH, the Center for Collegiate Mental Health. And everyone knows in reading that literature, there are 5 significant areas around student mental health that we focus on. And that is the awareness of depression, adjustment to college, anxiety, and relationship issues. And some students arrive with trauma and just dealing with stress. So using that as a starting point, we took time to understand what were some of the other challenges that students were experiencing since COVID. And we found and we realized, as all of you, that students were experiencing also challenges with isolation, loneliness, and also anger. Thinking about those students who transitioned to Winston-Salem State after completing their senior year in high school, being in isolation and away from high school, that we had to really understand that those students were arriving to campus and helping them to process through those emotions. So keeping that in mind with those 5 significant areas that are part of research, as well as the other 3 areas that I just mentioned, we tried to take an approach, or we did take an approach around wellness. How can we work with students that are challenged in those traditional spaces, but also empower our community to focus on wellness? So we're going to share 4 different things that we've done here at Winston-Salem State. One of the first things that we did, we wrote a grant for mental health first aid training. And from there, we took our colleagues and created a program to help them to connect with other students. And meaning that we wanted students to know that they were not alone. We coordinated work with their efforts and students to connect with faculty and staff who completed mental health first aid training to book appointments by using Microsoft Bookings. With that, they do what we call sip and chat and walk and talk sessions, where they are doing non-clinical conversations to increase and broaden our touch. So students can talk about adjustment to college, conflicts with their roommate, how to communicate in frustration with a professor, just to help them to connect and help them to adapt to college. We in the counseling center, as needed, are that support to those colleagues. When a student needs a clinical appointment, they're referred out to us. The second thing that we did was took time with our student interns that worked in our space to identify student-friendly mental health apps. And so to encourage wellness, we encourage students to use some of the mental health apps that are out there, particularly Wobot, Calm, I think it's called #Mindful. Those are some great mental health apps, and students really enjoy that. We all know we are in the age of technology. Students want to communicate to their cell phone. And so that has been a very affordable win. Thirdly, when students were in isolation and quarantine, again, feeling lonely, feeling angry, feeling frustrated, feeling alone, we did what we call calls and COVID calls. So we divided up those names between those individuals that have been trained in mental health first aid, as well as the counseling team, and made calls to those students in isolation and in quarantine, just wellness checks. Hi, how are you? And we had a form that we created in Microsoft Forms just to document our touch to those students. So if there was a follow-up that was needed, we as a counseling team conducted that follow-up. And then finally, as the last presenter just mentioned, we didn't want to forget the faculty and staff that are on campus. Many of them reached out and say, hey, what do we do? We created a curriculum and a self-care booklet. I did some presentations with the Provost Council and helped trained over 100 people. These are some resources by creating a curriculum and a self-care work booklet. What does self-care look like? What does anger look like? What do you do? What is EAP? How do you use your health insurance? And then exercises and tools individuals can use to support their well-being. So again, those are 4 things that I believe that were very affordable, very impactful to help our students, faculty, and staff here at Winston-Salem State University.
Thank you, Dr. Tilford. You mentioned wellness, and the other speakers mentioned wellness as well. Do you think, what I've just been thinking about is, do you think this is a moment where people might, as we move forward from COVID-19, begin to kind of focus more on wellness in general?
Absolutely. The emphasis is around being intentional. I think part of staying physically well is to stay emotionally well. I think those pieces, the brain and the emotions and the body go hand in hand. And so when we encourage wellness, we have that in mind, that loneliness can affect your body. And so what do? How do you balance your life to where you're not lonely to the point where it affects your physical well-being? How do you manage self-care? And I created an acronym around the word care so individuals know how to be intentional about taking care of themselves. So I would say absolutely.
Can you share that acronym with us?
Absolutely. So self-care, using the word care, C stands for create. Create a routine and schedule that you can manage, and that's realistic. Particularly when most of us were at home and some people were being school teachers as well as employees, and the kitchen became the office, and there was blurred lines of our times and schedules. So being intentional about creating time blocks of what your family, what your routine looks like, and using Microsoft Google and printing it out and posting it on a refrigerator. So everyone knows what time that we're going to do what, and it's managing your schedule so the lines don't get blurred. A stands for attitude. Be intentional about having a positive attitude. Sometimes that was tough. When we were last year and we were in isolation and quarantine and social distancing, it's like, what do you do? And so we created, and part of the curriculum with the faculty and staff is create a thankfulness journal. Write down things that you're thankful for and say those out loud, and be intentional about what you're watching, what you're listening to on TV that may impede your energy and impact your attitude. R stands for relationships. Choose the right relationships. If you know that engaging in certain conversations with certain people became a little bit toxic or was kind of a downer, kind of reorganize your friendships or turn down those level of conversations if the conversations has always lions and tigers and bears on my, that may not be a good conversation for you to engage with that person if it's affecting your mental health. And the last letter is E, and being intentional about eating well and exercising. I think all of us can get out and walk. Many of us, I'm respectful for those who may have some physical challenges. So respectfully, if you can get out and walk, apologize about that comment. And eating well, be intentional about not eating too many carbs and sugars, but making good choices with what you're eating, because overall that helps you to feel better.
Thank you so much. I was taking notes here. So that was like a rapid cycle session with you. So thank you for sharing. And again, stick around. We want to have you back with the other speakers as well. Our next speaker is good friend and colleague, Dr. Tabia Henry Akintobi, who is professor of community health and preventive medicine and associate dean of community engagement at Morehouse School of Medicine in Atlanta, Georgia. I would encourage you to find out more about Dr. Akintobi's work by reading the recently released book by Dr. Akintobi and colleagues. It's entitled The Morehouse Model: How One School of Medicine Revolutionized Community Engagement and Health Equity. And so we want to welcome Dr. Akintobi. I could say a number of things about her in terms of her work, but I would actually just kind of sum that up by saying that in this moment, in the past 18 months, I think she and I have been on a sprint marathon in working on a number of projects around COVID-19. And I want her to share some of that work with you. We invited Dr. Akintobi because you've heard about the work that Voorhees, Winston-Salem State, and Bishop College are doing around engagement and working on campus. And beyond their own campuses, and even to the families of the students and faculty and administrators. But the work of Morehouse is really having a ripple effect across the US. And I've been so excited about it, many of us, because it's one of, I believe, 4 academic medicine centers on the campus of historically Black colleges, college or university. And so Dr. Akintobi, welcome today. We're just so glad to have you join us today as a friend, colleague, and as someone who, again, who's providing amazing leadership in this moment of a global pandemic.
Thank you so much, Al. I'm honored to know you, CCPH, and certainly to be a part of this panel. All the things that my colleagues have shared represent many of our efforts here at Morehouse School of Medicine. And I actually want to start with an event that is coming up. Let me know if you can see my slides. They're coming up now.
Yep.
All right, I'm going into slide mode. Because when we think about the young people that we're training to be the next generation of thought leaders and experts, we certainly want to ensure that we attend to them. And all of my colleagues have talked about the toll that COVID has taken, but it doesn't take away from our institution's mission to train them to be experts who reflect the communities that they serve, who reflect a history of engagement with communities and for communities. So this is an event that is coming up that reflects collaborations with many of the HBCUs, MSIs, and HSIs that's focused on really elevating young adult voices in the fight to bounce back and to spring forward from COVID-19. So you may not be familiar with all of the names here, but Jeff Street works with Usher, with an organization called Usher's New Look, and they're focused on really elevating young adult leadership to address the pandemic. Dr. Amunga and Dr. Samples and the young people next to them in the slide that you see are students from Fort Valley State University and Savannah State University, respectively. And these young adults will be talking about either their COVID experiences as leaders on campus, and some of them actually experienced COVID and are talking about why their voices matter. Some of the other people that you see here were involved in clinical trials designed to engage young adults, like Dr. Kizzer, who's focusing on a study called COVID-U to engage young adults in decisions towards vaccine trial participation, among many other things. So once I get through, I'll put the registration link in the chat. We invite you to join us on this discussion for and by young adults. So just as a quick reminder, you all, and I know this is going to be shared via CCPH's website, we have a long way to go. We still have not enough of the US population who has gotten both doses of the vaccine. And no matter where you are in your decision, or as was shared earlier, the decision of young people to think about getting the vaccine, we want to remind all of us to do things like wearing masks, staying physically distant, as well as washing hands. And so just to kind of level set, I think the unique position that HBCUs have when thinking about not just securing the comprehensive wellness of our faculty, staff, and students, we have to think strategically about our position as influencers in the communities in and around our HBCU campuses. Historically, the health issues and health disparities that we knew were there before COVID are rampant in and around our campuses. So for us, we know that many of the neighborhoods in and around Morehouse School of Medicine reflect those with increased likelihood of cardiovascular disease and diabetes, which both predispose for the likelihood of disproportionate hospitalization, illness, and death from COVID. But the positive news is we have maintained a pursuit of trustworthiness with communities, and not just the communities in and around our campuses, but of communities at large, meaning those that are less likely to be understood, less likely to be given a chance to excel. And so for those reasons, just as we secure our campuses, we must be on we must recognize the position that we have to be thought leaders and action leaders in conversations surrounding COVID, as well as vaccinations. So I'll just put this slide up, and I know that folks will see this beyond those that are on the call now. Think about where your HBCU is. And when you look at this slide, what it shows you is that as of just a few weeks ago, and the numbers haven't changed too much, those states that have the lightest colors means that they are least likely to have adults who are eligible to get the vaccine to have at least one dose. So think about where HBCUs are nationally, and specifically in the southeastern region. There is too much light blue there, meaning that there are not enough individuals who can get the vaccine who have gotten it. And my colleagues before have shared all of the justified reasons that students, as well as faculty and staff, are not ready. I like to really think thoughtfully about using the word hesitant because it connotes that the individual has the problem that needs to be fixed. And the truth is that historical atrocities, whether they're clinical or research with communities of color, depending on who cares about those issues, and many do, or current issues like were shared earlier. My mom and my parents say that they don't know what's in the vaccine, and I trust them as these young people do. There are many whys that we have to understand towards the path forward. So my reflections and the opportunities for you to access some resources and information will be based on what Morehouse School of Medicine was doing long before the pandemic. I say that in all humility, and I think all of my colleagues would. We were in this to be safe spaces for our students, for the community, for our faculty and staff. And so when COVID came, while the pivot required adjustment, it was more of what we were already doing. It's just that we were called into action to do it in ways we hadn't done it before. And so through the Prevention Research Center, which I serve and lead, we look at and prioritize and live out risk reduction and early detection among African American and other minority communities, whether they're defined by gender, sexual orientation, geography, meaning rural or urban, immigrant status, etc. And so at the core of the Prevention Research Center is this community coalition board model, which is not advisory, meaning that the majority of its members and leadership must be of the community, meaning I cannot be in the majority or have voting power or leadership seat. And so they set policy to ensure that every initiative that we decide to proceed with, that it has the community's interest in mind. And what that has historically and currently means is that when we're thinking about any type of initiative, there must be social services and resources that are in place that may have nothing to do with the health issue like COVID, but reflect a respect for the fact that community leaders and students and others have immediate needs that must be addressed if we are going to get their attention on the thing that we think is important. And so that model has allowed us to be able to scale up community leadership that has been applied to COVID. So some of that has involved this leadership being expanded for the state to advance the art and science of community engaged research that matters with rural leaders, community agencies, and neighborhood residents. These were things that have been happening for the past 2 decades. And so I bring them up because they reflect how we were poised, not perfect, but poised to be able to respond to COVID. And as some of my colleagues described, we heard from our communities through what's called a community health needs and assets assessment that we've done for the past 15 years. For the first time in 2018, you all, mental and behavioral health came up as an issue that they either were struggling with or that they thought were critical to any issue, any program, any response strategy. You all know 2018 was right before COVID came, but it poised us to put mental health as a priority area on our agenda. So through conversations that happened in 2020 and 2021, as you see here, I was pleased to see Dr. Tilford talk about mental health first aid, which we offer to community leaders as well as others at Morehouse School of Medicine. And then, as I heard earlier, also, we had to make sure we reflected on ourselves. So you can see here, just last week, we were doing some art therapy for our staff, faculty, and students to say, look, you all are gonna be the next generation or you're already leading. And we want you to attend to yourself, look in the mirror, and really, what do you see? What is your why? Not to respond to COVID, but why do you keep pushing? Why are you seeking your degree? How can you make sure that you are full as you continue to give? Some of the other things that we've done that really have poised us through these to have these conversations and impact is an invitation through the CDC to talk about community engagement in the era of COVID-19. And so I can put that link in the chat, but it speaks to so many things that have already been shared about the importance of the mental health issues that have been exacerbated, and particularly for our young people, increased suicide ideation, increased interpartner violence. And the authors of this particular invited piece included many of the community partners that were working with us long before COVID, but were poised to respond to this invitation to say what needs to be in place towards a path forward. So yes, we've talked about it. Al talked about this book called The Morehouse Model. All these things were ahead of COVID, but we've always been reminded, those things are great, but for the community, what happens with the data and the information that you get? So we've partnered, and Al is at the helm of the whole network for the RADx Up program, but we're working with rural and urban residents in Georgia to promote COVID testing. So separate and apart from the vaccination, but probably more important now than ever, is promoting testing so people know their status, particularly those who are at risk for or who have diabetes. And when we think about the risks for risk, you all, the fact that obesity is now an epidemic and overweight and lack of physical activity, especially for our young adults who are stuck, not as much as they were before, but are limited in terms of their ability to be active and to move. You can understand why focusing our efforts on Georgians who are at risk for or who have diabetes, which are a lot of folks, has been our priority. And so we're doing a lot in the community. You can see at this table here is a former MPH student and me spreading the word not spreading the word, but engaging community residents at a recent Jazz Fest to talk about this issue and have them participate and share what their experiences have been if they either have diabetes or are a caregiver or have a family member with diabetes. Al is a part of this network, and I would encourage you, if you are not aware, we can share the link to the SEAL network. SEAL is a community engaged alliance against COVID disparities. And you saw that map that I shared earlier. Many of our HBCUs, including you, are in the states where the numbers are too light, meaning that not only are there fewer adults who are eligible and children who that are getting vaccinated, but also that those are likely the states where there's more COVID positivity, meaning more people are getting COVID, right? And so we are here to position community leadership, and we see MSIs, as I shared with you earlier, HBCUs at the center of being trusted voices to have safe conversations about tough things. And we hope that that will inspire vaccine confidence, COVID mitigation confidence, and then vaccine uptake. This slide shares many of the community leaders who are a part of our board, and they are not individual community-based organizations. They are organizations that represent networks across the state and beyond. We were able to stand this up very quickly, you all, because of relationships and trust that we built for many years. So a lot of this has to do with having conversations. And if you look closely with our focus on Black and Latinx and rural and urban residents in strategic spaces in Georgia, many of the moderators in these discussions do not look like me. And I'll show you a few, they're much younger than me. We realize and are very, we recognize that the best influencer or voice is not necessarily us. And so we are here to be able to share the science in a community credible way, in a community sensitive way, and couple it with leaders that are trusted to have safe conversations. And so we had one recently that focused on faith-based influencers. Each of the folks on here represent either the Muslim faith, partners in primary care, and also leads of denominations in the state. So again, not just individual churches, but for instance, Elder William Winston is over the whole Seventh-day Adventist Alliance in the state of Georgia. It was a great space to have very candid discussion, and that's where the discussion surrounding the young people came up, and that's why we're having the event that I shared with you earlier. And so not only do we do, you all, but we have to be able to demonstrate impact. People often feel like the work of HBCUs is only high touch, but we are clear, and I know you all are as well, that high touch, that intimacy, that mentorship, that family environment can be coupled with evaluation and data to demonstrate that through the students that graduate from our institutions, as well as the results of our partnerships, we are making a difference. So the Mexican consulate approached us, as many other organizations across the state and beyond have, because they know we are on a pursuit for trustworthiness. It doesn't mean perfection, but the pursuit. And collectively through our efforts, we have vaccinated over 50,000 community residents and healthcare professionals. So just a reminder, you all, impact is important, but we are clear that the relationships and partnership is the path to this. And so before I close, one of our latest initiatives is focused on what we call Georgia Peers. or Peers for Equity Against COVID-19 and for Health, Georgia Peach. And through it, we're looking to inform and educate about COVID, address mistrust, and use appropriate mass media to develop platforms that are for and by young adults, whether they are college bound or community based. And then tapping our mobile vaccination unit through Morehouse School of Medicine. We will be going to the Fountain City Classic to talk about all the things I described and to vaccinate young adults. And this game is between Fort Valley State University and Savannah State. So quickly, I will share information surrounding the National COVID Resilience Network, the only grant funded nationally to address COVID resilience through Morehouse School of Medicine. I'm really honored that Al through CCPH is an important partner in this work, and that our Community Coalition Board model has been scaled towards a national community majority approach to addressing COVID-19 across racial and ethnic and disproportionately affected groups. You can find us at www.msm.edu. And what you can do with that is you can select a language and you can share this with your students, faculty, and staff. You can identify and track symptoms, find based on your address where you can find mental health services, behavioral health services, vaccination centers. And you all, this is nationwide. And so I'll put that information in the chat as well, so you can share it as a resource by one HBCU or HBCUs across the nation. So I will stop here and just say we are here to support and learn from each other. And Al, thanks again for the opportunity.
Thank you, Dr. Akintobi. I'm like tired. I'm exhausted from all the work that you're doing in Georgia and beyond. Thank you for joining us this afternoon to really give us a glimpse, I think a snapshot of the work that you're doing at Morehouse School of Medicine, not just you, but other committed faculty and staff, and then your student network as well that have joined together to address this issue. I think it's, the takeaway is that Morehouse is leading the way in many regards to being responsive to COVID-19 related issues. You talked about the risk of the risk, and that really kind of captured my attention. Say more about that in terms of, how this moment, again, we talked a little bit about, could it be a moment where people think more about wellness into the future? What about reducing their risk overall for chronic disease?
Oh, wow, Al, you said it. And I think the first part of the response, I think Dr. Tilford teed me up for it quite nicely. But the truth is that, let's just say about 2 years ago and decades before, when we were talking to people about their cardiovascular health or sugar, as they described it, or potential diabetes risk, we would talk about the importance of, being physically active and watching their diet, etc., thinking of that nice CARE acronym. And, they would hear us, and they might hear us because we're Morehouse School of Medicine. But, in many instances, they would say, well, that might mean, I might live 10 years, my lifespan might be 10 years shortened, but that's all the way over there, right? But here came COVID, and having those risk factors meant imminent death within weeks. And so we're in a place, you all, it's an unfortunate place to be in, but if we think about it in terms of flipping the script, people are more attentive than they ever were before. So, whether they have cardiovascular disease, diabetes, or asthma, when we think about the risks for risk, like overweight, obesity, being physically active, we have to think out of the box to co-create for them ways that they can do it based on where they are, right? They're in many times communities where there are no sidewalks, where we're having to do everything by Zoom now, but they are listening in ways that they didn't, because death may be 20 years down the road. They realized for their family and friends, and I'll speak some for myself, meant death in a few weeks. And so we have an opportunity to capture with communities on how to do this better and make sure that community voices based on what they have experienced are along with us to really help turn the corner.
Move now to maybe a gallery mode where we can actually we're going to ask our speakers to actually to come back on camera. We'd like to invite you all back. And we'd love to hear more from you and your voices in this space. As you've been hearing the discussion this afternoon, what have been some of your thoughts? We want to also encourage those of you who have joined us to chat in any questions that you may have. What are you thinking about in this moment? I'll just actually start with Suzanne. You've had a moment to hear some of the other presentations. What are you thinking about in your work at Voorhees in terms of even replication of some of these models?
I definitely think we're a small college, so and I'm the only health services person here outside of my partners that I have, externally. So hearing about the CARES acronym, hearing about Morehouse School of Medicine, the testing, and just encouraging the vaccination, having those outreach things going on. It lets me know that we're small, but we're mighty, because we're right there. And just not trying to just run the whole race, but being intentional on everything that we're putting in place. And I looked at the map that Dr. Akintobi showed, and we're in South Carolina. We're not too light, but we're not dark enough. And and what we did do here at Voorhees, we are actually a testing site and a vaccination clinic site. So it is open to the community and for our campus. So that was my first thing, because of the health disparities that we face, and encouraging the Black community to really be accountable and step up and get vaccinated, and don't be afraid to speak about it. It's like what I'm seeing sometimes. Some people will say, I know they're fully vaccinated, but they're just not so comfortable saying it out loud. And I struggle with trying to understand that, because the last thing you want to do, once you get someone that trustworthiness, that confidence in you, you don't want to push them away by questioning that or making them feel, kind of, for lack of a better word, hesitant. But I don't know, but I do feel like I have learned a lot from all of the speakers. I'm grateful for the knowledge that they shared with me, that I could continue on keeping our, community and our campus safe.
Thank you. Symentha, as a small school, Bishop College, you described the work that you're doing there. I wondered about how you're engaging with your community in Mobile. And can you share some examples of additional work that you all are doing there with your community?
So the main thing we're doing with engaging the community is just trying to work on partnerships to get out the word about, vaccines. Like we're talking about vaccine hesitancy amongst people. It's a collective effort, not just, to get this to try to send that message to the students, but to also try to get it to through the community. So, that is our whole group effort. And I would say that's our big thing, with the community and partnering with our low cost medical provider that's right here kind of at our back door, and our local county health department, which is at our front door. So, we back up to one, we're at the front of the other. They're in our area, they're in our community. It's a big part. So we're working with them to try to, get that word out, to partner on this, among other things. So it goes into just the same as everyone else was saying, the other wellness overall. They don't come with just the ability to give the vaccination shots when they come. They're coming with flu shots, or they're coming with, sexual health things. They're coming with all these things. And it just helps us, kind of cover the board and do what we need to do to help our students who are members of our community, as well as their family members who are members of our community, to just help the big picture overall.
Symentha, that's well said in terms of the fact that where you sit, you describe this, I can kind of visually see it, that sounds like you've got a FQHC behind you. You have that health department across the street. There you are, kind of like positioned right there in the middle. And then you talked about my favorite word, which is partnerships, right? And so that you don't do it alone. And then you're also talking about this more holistic approach again around health. It's around like these agencies and these partners bring a myriad of resources that your students need, but also in their families. I think in particular for your institution, which is primarily a non-boarding institution or non-residential campus, where many of the people are living in the community, right? They live there. So it presents a really unique opportunity. Yeah, no, thank you so much. Dr. Tilford, you really set us off there with that CARE acronym in terms of being focused even on our own health. And as you've been listening this afternoon, I wonder if there's some other comments that you might add around kind of wellness, but also just kind of this holistic approach that we recognize is important. I mean, for us with Community Campus Partnerships for Health, this was, we wrote this proposal back in 2019. We could not have imagined that we would have a global pandemic, and we will focus primarily on cardiovascular disease. But I think that everything that people have said this afternoon has said to us, like, we had to make this transition. We had to do this work. What are you thinking at this moment as well around this kind of more broad approach or holistic approach to addressing health?
I love it. I love listening to the speakers because when we think about the add-on to what we need to keep in mind in managing our health and being intentional about our health, it was reassuring as we think in our spaces here at WSSU of the uncharted territory of what do we do, right? I think a lot of us, as they say, we were flying the plane while we were building the plane. And because our passion for our students and definitely wanting to connect with our colleagues, I think to me to hear the ideas and the information was great and supportive in the direction that we're trying to go at it as an institution and specifically a counseling center. I think one of the things that jumped out for me, and I love hearing ideas so I can copycat. And so the art therapy for the colleagues, I'm definitely going to work to see how we can integrate that in our space here at WSSU. I think that'll be great. They really embraced that. I, again, was on a panel with 100 plus colleagues with a provost type of leadership meeting. And so I created a curriculum for them to use individually or in staff meetings. And so one of the activities that I had was them to process anger. There's an activity called the anger iceberg. And I think because they want to understand students and the behaviors that they were presenting, as well as learning how to lead their teams and engage with their colleagues and understand the behaviors that are out there. When we talk about emotional health and the physical health and what people are experiencing and the death and everything associated with health issues prior to the pandemic, understanding the emotional experience with that. And anger is one emotion that is hard to talk about and oftentimes the socially acceptable behavior that we have in our community. And so having that activity and helping them to understand that maybe anger was presented, but really, it really was another emotion. And having our colleagues to unpack with that and being able to be open about that was great. And I say that to say that as I listen to everyone and ideas to help them continue to unpack, whether it's art therapy activity, to help them process all the things that they're experiencing as they're trying to teach students and making sure or lead students in their spaces and make sure the students are okay. So that was my thoughts.
Thank you. Dr. Susan Powell from Jackson State University in Jackson, Mississippi says, what educational programs have been implemented to help educate those students who are not vaccinated? And I think, Suzanne, I believe that you talked a little bit about what you were doing at Voorhees around that area as well. I'd love to hear from you about what are you doing there around education?
Okay, so really, what we do, we have scheduled COVID information
And
sessions.
I think by the way, you're sitting right in your office, right? Aren't you? It looks like you're.
I am.
That looks
I'm in
like
the thick of things.
the quintessential HBCU clinic office, right? That is.
Absolutely. If you look a little further, you'll see the Lysol wipes, your disinfectant, the mask, you see it all. But so we do. I schedule dorm meetings with like COVID information dorm meetings. I send out emails with information, and I send out emails first that shows, like I said, how the vaccine's made, what's in it. Just a simple, it's like layman's term, because I can't go speaking to them in a certain way. They're not going to understand that. And it's not an issue of comprehending, but they're young adults, and you just want to give it to them straight. And even my faculty and staff members, same thing. We just had a town hall. We have incorporated our SGA, our student lead government leaders, to do a vaccination and testing initiative. So we had our town hall, the students led it, and we were able to get honest and genuine the questions that they need, and we address them then. If I see them at the cafeteria, we're talking about COVID, we're talking about the vaccine. Any opportunity that I get, that whether it's scheduled or not, I'm going to listen to what they're thinking, what they want to know. We're going to address it. We just had like a public health expo. We had like some food trucks out here. We had the vaccination clinic going at the same time. We have people strategically placed with the vaccination information, with COVID information, and not only just feeding them what, is printed, but also letting them see it. A lot of our kids, it has to be tangible to them. I could tell them all day, but I have to direct them and guide them to the proper place to where they can find that information from people that look like us, who speak like us. That's very important when you're trying to establish that trust, and you want to give them those information about the vaccine and testing.
Thank you. I've been inspired this afternoon or today to just really think about all the ideas that you're offering to us. And one of the things I came up with is a new idea. So our team has to get ready, because I have a new idea. That is that continue to visit our website at ccphealth.org. We're going to create for you and your use a hub of resources that are generated by historically Black colleges and universities and other institutions to house information that we can share. So I appreciate this exchange that you all have been engaged in today. I've learned a lot, and I hope that others have as well. This website and others can also be posted on, we will post them on our website, and you can access them by visiting our website at ccphealth.org, ccphealth.org. You will receive in the next couple of days a invite to an upcoming, here it is. Yeah, it just appeared here. Upcoming town hall meeting. We're inviting all our speakers and all of our participants to come back and join us on Thursday, October 7th from 5:30 to 7 p.m. Eastern Standard Time for the At the Heart of the Matter Town Hall, which is designed to develop an action plan as to how do we take all of these ideas that we've been hearing about over the past month and a half, synthesize all of that and share across the HBCU network and beyond. So please just click on that, use the QR code and click on that and access more information about the town hall meeting on Thursday, October 7th, 5:30 to 7 p.m. Eastern Standard Time at the Heart of the Matter Town Hall meeting. Again, I'm Al Richmond, Executive Director of Community Campus Partnerships for Health. We can go back to that slide. Sorry, I was going too fast. Hey, yeah, we want to encourage you also to find out more about funding opportunities that are related to COVID-19. This slide has two of those opportunities. They are, I'll highlight the Community Collaboration Mini Grant opportunity. This is a $50,000 grant provided through the Rapid Accelerating Diagnostics for Underserved Population Project, RADx Up, and community groups, HBCUs and others can apply for these community collaboration mini grants to support your work focused on COVID-19. The work must include testing. So it has to center COVID-19 testing among underserved populations, including medically, geographically, and socially vulnerable populations. So you can find out more about that by visiting radxup.org. Again, this is a wonderful funding opportunity to receive up to $50,000 to support all of the amazing work that you're doing. Next slide. So visit our website, ccphealth.org, at the heart of the matter. And you can also email me at alrichmond@ccphealth.org. I'd love to hear from you and feedback from you about the work that we're doing to advance social justice and health equity. Thank you to all of our speakers, and thank you for joining us today.